Hi, beautiful people. How are ya? Are you having a great day? I hope so. I've put out my fall decorations a little bit up there. Got my pumpkins. And then I've got over my fireplace done. We've explored green light therapy, and one of our beautiful subs asked if I had heard of red light therapy. I said I hadn't, so I instantly had to search red light therapy. I discovered that I have a little experience with red light therapy that I had forgotten about. I'll explain that in a moment. I appreciate your thoughts on any of the topics that I come up with. Many of them are things that you all think about and want to know about. So, today, of course, we're going to be talking about red light therapy. This is a treatment that uses low levels of red light that is believed to improve skin appearance, aid in wound healing, and help us to recover from a fracture. That sounds awesome. Red light therapy has anti-inflammatory effects and can reduce pain. So let's explore this. Here we go. You may hear red light therapy called one of the following: low level laser light therapy, low power laser therapy, non thermal LED light, soft laser therapy, cold laser therapy, biostimulation or photonic stimulation, photobiomodulation, which I've seen this one often in research, and phototherapy. When our dog, Goldie, got bone cancer in her leg, my husband bought this low level light therapy. It's a wand and it looks like this. There's a on buttons up here. It takes me a second to figure it out. There it is. And you can see the red glow from it. But I used it on her leg. They said that her leg was fractured, but due to bone cancer, there really wasn't anything they could do for her. So I would use that wand on her leg several times a week, as often as she would let me, for quite a few minutes at a time. And this is what's called a handheld cold laser therapy device for pain relief and healing, it says. This one is made by Ph.D and states it's suitable for pain relief, knee arthritis, rheumatoid arthritis, wound and ulcer acupuncture, soft tissue injuries, sports injuries and sprains, accelerating skin healing, and diminishing inflammation. I've provided a link below about this device, but you can get it from Amazon much cheaper. We didn't pay what they're asking for on this particular site. The light, to me, at least initially, feels warm. It's not like it stays warm, but it is soothing. Obviously, it didn't cure her, and somehow we felt it helped her a little. It doesn't use UV, ultraviolet light, so there shouldn't be a risk of skin cancer. But if you do have skin cancer or have had it, please check with your doctor before using it. If you take medications that increase skin or eye sensitivity, don't use red light therapy. This non-invasive treatment has many in-home devices, such as masks and wands, but a doctor's office would have stronger lights and would most likely be pretty expensive. You can cause your skin to be red after an at-home treatment or even blister, so be careful. If the wand, let's say, says to use it for 5 minutes, then only use it for 5 minutes. Common sense. What I didn't like reading was that red light therapy can cause eye damage. So wearing protective eye goggles may be necessary. I wouldn't use it on my face unless I was using strong protective eye goggles or a mask. You all know about my eye issues. I don't need to drudge that up again. So even though this is a safe treatment overall, please be careful when using it. Apparently, red light therapy is at a frequency of wavelengths at about 633 on average nanometers. My handheld device, that one, is at 650 nanometers. Green light therapy is at 532 and blue light at 415 nanometers, give or take a few. All of these provide some benefits, but according to researchers, red light therapy is most effective as a therapeutic window for light that lies within the wavelengths of 630 to 680 nanometers or at 800 to 880 nanometers. Red light goes deep into the skin, and blue light affects the uppermost layer of the skin. So basically, red light therapy boosts energy production in human cells by stimulating photoreceptor proteins, like that idea, called cytochrome C oxidase. Over 6,000 studies have shown the health benefits of red light therapy and near infrared light. There is some evidence that red light therapy can reduce wrinkles, scars, redness, and acne. But if you take Accutane for your acne, you shouldn't use LED light therapy. And never use it if you currently have a rash. Red light therapy may reduce inflammation and stimulate the production of collagen, a protein responsible for younger looking skin that diminishes with age. Whereas blue light therapy may destroy acne causing bacteria. That's interesting. Has anyone ever had an acne treatment with LED therapy at a, let's say, dermatologist's office or at a spa? I think this would need to be monitored by a health professional. But according to Healthline, red light therapy can help treat skin conditions like psoriasis. This isn't a one and done treatment. You need to use it regularly. Red light therapy treats the epidermis of the skin, the outermost layer. And when the light is applied to the skin, the epidermis absorbs it and then stimulates collagen protein. More collagen, in theory, means that your skin will look smoother and fuller, which reduces inflammation. And in a 2014 study, a reduction in fine lines, wrinkles, skin roughness, and intraepidermal collagen density was increased. Wavelengths of 611 to 650 nanometers were used. NASA originally developed LED light therapy for plant growth in outer space and found it to be a promising wound healing treatment. Although red light therapy doesn't have the same antibacterial effects of blue light therapy, it can still be effective. promoting healing and working to decrease the visibility of acne scarring are great benefits. In this 2017 study, the researcher, M.R. Hamblin, stated red light therapy was shown to reduce inflammatory markers in activated inflammatory cells. The anti-inflammatory benefits of red light therapy is due to the light working deep below the surface of the skin. It soothes and repairs tissues. This is important for disorders of the joints, traumatic injuries, lung disorders, and in the brain. Red light therapy, or photobiomodulation, reduces markers of M1 phenotype in activated macrophages. That means inflammation is reduced in the brain, abdominal fat, wounds, lungs, and spinal cord. Very cool. With my recent diagnosis of osteopenia, I think bone healing sounds incredible. Red light therapy penetrates deep below the skin, reaching bone tissue and improving cellular energy production, circulation, blood vessel formation, and collagen synthesis. In a 2022 study, researchers used near-infrared spectrum light, which is at 810 to 850 nanometers, a little bit stronger, to penetrate deeper into the skin than just red light, including the connective tissue and bone. I think we'll learn more about this in the future. When NASA used red lights to increase plant growth, as I mentioned earlier, it worked. But a byproduct of that experiment was the discovery that when scientists were exposed frequently to intense red light, they saw rapid healing of their skin lesions. NASA began to study the use of LEDs to increase human cell metabolism and stop bone and muscle loss in astronauts. And over the years, the technology has spread to the general public. According to researchers, red light therapy has the ability to naturally reduce inflammation and pain in the skin, muscles, and other tissues. It increases blood flow, encourages antioxidant activity, and lowers inflammatory markers in the body. In addition, red light therapy improves chronic pain symptoms. That's what we want to hear, right? And conditions such as joint pain, back pain, and neck pain. Painful tendon injuries and inflammation can also be treated. I think I have tendinitis in my wrist right now, osteoarthritis in my fingers, and plantar fasciitis in my feet. And these cause me issues. And perhaps I would benefit from using red light therapy on those areas. Also, dental pain would potentially benefit from red light therapy, is what is stated in articles. Decreasing stiffness and increasing range of motion is also a benefit. I mean, to get that, I would think you would need to have the red light therapy in a medical facility or someplace like a spa to get the full benefit, more of a full body rather than, a wand. But I've got work to do. I think we get the idea that it is possible for red light therapy to have a positive effect on our health, specifically mitochondrial homeostasis. When oxidative stress occurs, it can lead to decrease in the activities of mitochondrial complexes and ATP production, which can increase free radical generation. That's a lot of words. I've talked about these before. So, what I'm saying is that ATP drives all chemical processes in the body. So, if you're low in ATP, you're going to feel exhausted and dejected. So, the more we have, the happier and productive we are. So, mitochondria are the biological batteries in human cells. Red and near infrared light recharges them. So, we can get therapeutic effects from red light therapy. Have you tried it? I hope you learned something. I send you gentle hugs and support. Love you. Oh my God, you scared me. Okay, I have to start over here because I don't know where I'm at. What? Ooh, I never got into it. Is that on Netflix? Oh, yeah. We have HBO Max, don't we? Oh, all right. I had a slight interruption. My granddaughter came home and we had to work on her financial aid for college. A little, not really an issue with the aids, some other things. So we're getting her all set up and taken care of for starting college. Oh, yeah. It's wild, isn't it? Ah. It is? It's black?
I can see it when it blows in the air.
Oh.
The wind.